We have initiated with our African elephants as well as some other institutions, and she's going to tell you all about it. So I'm going to let her get started so there's plenty of time for questions.
Yeah. Okay. Nice. It's nice and loud. Thank you. Thank you for having me, and thank you for being here to listen to a lot of talk about elephants. So I know I see some familiar faces, and some people will have seen parts of this before, but there's a lot of new stuff as well. So there's so much information, and people that know me know that I could talk about this for days, but I don't have that opportunity, so I'm going to really highlight the focus of why we started this, and what is our main mission to do this, and why it's so important, and why this is putting Kansas City Zoo on the map for elephant conservation on a global scale. It's very powerful, and it seems we've only begun this in April of 2017, so it's really new. But with that newness, we've made tremendous, tremendous progress, and there's only more to do. So usually you put this at the end, but it's so important that I say this because without the Kansas City Zoo, this wouldn't happen. I approached Randy a couple years ago with this idea, really large idea, and he was kind enough to say, I'm interested, bring it to Kansas City and let's hear what you have to say. So there's just that first opportunity of, will you hear me out? It's a big project, and he said yes. So a huge thanks to the Kansas City Zoo, to the Conservation Fund, to the elephant care staff, Dr. Kirk, the whole team. I'm speaking about this, but it's really not me. I'm a tiny part of this. So everybody here has a role in this, and you'll see that. So a huge thank you. It's not all graphs. I'm a scientist, so I love graphs, but it's not all graphs. But I just wanted to show you quickly the situation that we're in. So this is showing the births, the African elephant births from 2000. So you think, awesome, 2.7 births per year during the last 18 years. This is great. We have babies. We're doing well. Looks fine. Oh. Don't look until you see the deaths. On average, 4.3 deaths per year in the last 18 years. So you do the math, you can really quickly realize that we're on a negative growth rate, which means more deaths than births. That's not acceptable. Our population is predicted to go extinct within 50 years in the zoo population if we don't reverse this negative trend. Oh, that's awesome. Somebody will do it. It'll work itself out. It won't. There's nobody, has been nobody, no group to really put the focused efforts on figuring out what needs to happen and putting the efforts and the funds into making that happen, regardless of where those elephants are. So when we go back to, well, let's see what we did right. If you look back in 2010, oh man, I'm going backwards. If you look back in 2010, where we had the most births, I did some research to figure out what happened during that time period. And it was because the previous years before that, there was a really focused and collaborative effort on helping the population. So it's proven that it takes a really focused group. So that was a graduate student, advisors, so a really focused group looking at the population. So it's telling us that it can happen, but it really takes focused efforts, and it takes teamwork, and it takes collaborative approach. The bad news is, look in the last 5 years. So something has to happen. So our target population, so within the AZA, within the zoo population, they do all these population modeling, and based on how many zoos and the available space they have, there's space for 225 African elephants in North American zoos. We're currently at 162 elephants, 123 males and 39 males. 123 females, 39 males, just to give you an idea of what we're trying to aim for. So I'm going to give you a visual of what this looks like in terms of breeding. So yeah, I copied and pasted each of one of those brown elephants 123 times. And I counted them a few times. So anyway, there's 123 female African elephants in the AZA population. So you think, great, that's a lot of elephants. We have no problem for this breeding situation to keep our population alive. So the species survival plan puts together breeding recommendations for each elephant, for each animal that has an SSP plan. So based on this, then they have to eliminate some of the population, of course, due to age, other reasons. So within this document, they put the exclusions. So you go from your 123 females, but then you have to account for the exclusions based on the SSP. So if you do that, if an elephant is over 40 years of age, you eliminate those elephants from the breeding pool. So you're eliminating 12 elephants. The second is if an elephant is 24 years of age or older and has never reproduced, you eliminate her from breeding recommendations. So you're eliminating 50 elephants right there. So the blue shaded area is the elephants then that we're eliminating from the potential breeding population for females alone. So 123 sound good. Now we eliminate 62 of those elephants. So now we're down to 61 elephants. And this is regardless of health status, anything, right? This is just female elephant that's under 40, has reproduced before those criteria. So you look at these elephants, you're trying to look at from a population standpoint, what is the goal of these 61 elephants? How do we keep the population sustainable? So again, we're looking at trying to get to 225 elephants. So these population modeling in these stats I'm showing you are based on the 2.5 births for 3.8 deaths from that windows. So right now we know that the reproductive rate, that's not going to be sustainable to sustain our population. We know that. So we said, well, what if we do everything we can? What if, well, we do nothing, and by some miracle, those 61 elephants are able to produce a population increase. So if there's 0 deaths, but we have 4 to 5 births per year, will that work? That's not enough. The population is not sustainable. Like, all right, let's look at the next situation. What if we would have 6 to 7 births per year? So it would take about 48 years for the population to be sustainable, and that's only if we had 100% successful reproduction, meaning there's 1 calf every 5 years for each female. Who thinks that's possible? Not. So even under the most optimistic situation of 8 births per year, we'll get our target population in about 34 years. Thank God, maybe in my lifetime, which is only 1 calf every 4 years. So this is not looking good. So, okay, let's look at this document, close it, put aside. Somebody will do this in a year or 2. We don't have a year or 2 to really get to individual elephants to see what we can do to increase this population. And not just from the population getting enough animals, but just from a welfare overall standpoint of elephant care in zoos, doing what we can do for reproductive health. That's all part of the goal of zoos anyway, is to show that optimal welfare and reproduction. So we go back to, well, let's increase the number of elephants that we potentially have for breeding. Let's increase that. So looking back at these recommendations, what we can target in on, which was a huge focus, and I've always been haunted by this, for an elephant that's 24 years and older, never reproduced, that's 50 elephants. That's a lot of elephants to eliminate just on age alone, age and not having calved before. So from my research in Africa and just all the research that has been done by prior researchers in Africa, we know that elephants reproduce into their 50s. They actually don't go through a menopause. So elephants are capable of pregnancy and birth much, much longer than age 24. But the primary factor is that those elephants have been reproducing from a very young age. So they're not starting at age 24. Typically, they'll be pregnant around age 12, right? So we really think that having that first calf early is very important to their long-term reproductive health. That's really important for us to put focused efforts on young females to ensure they're getting breeding opportunities when they're young. So again, we're not missing this opportunity and all of a sudden they hit 24, done. So we have to be responsible in looking at those young females, but also this older, 24 is not old, this group that's in this never reproduced category, because we don't have enough science to say for sure that the risks are that bad to not breed older African elephants. So the whole goal, so the elephant tag and the SSP actually recommends that females that haven't given birth before, over age 24, there's been limited success. Basically, there's difficult birth and miscarriage. Now, it's not a large population set. This is a handful of cases, but enough to warrant, like, hey, over 24, if they haven't calved, if they get pregnant, we see this. So I'm really diving into looking at this closer, because the science isn't black and white here. There's not enough for me to feel confident to eliminate an elephant at age 24 based on the science we have so far. It also says that if you do decide to breed over 24, you should take all these factors into account. So then it's not an age-related thing, it's a whole picture of that elephant's health. Are you looking at obesity, body condition, many different factors that I'll get into, so not just age alone. So one of the main goals of this initiative was to look at individual elephants that are over 24, that have produced calves and haven't, to really put some science behind should this elephant be eliminated from potential breeding or not. And again, it's not saying they should or shouldn't, it's let's make an informed decision. Let's provide the resources to potentially look at every elephant to see if they should be added back to that potential breeding pool, because that has a huge potential long-term effect. So again, it's just adding science to what we do. So you think, well, what are all of those factors? And so those guidelines are pretty vague. So it's up to us to look at our research in prior years to figure out what does affect reproduction in elephants. So these are so many things. Husbandry, social status, or how you manage elephants as a group or by themselves, feeding practices. A lot of my initial research was on body condition or obesity, same things, looking at how that affects reproduction. And then I found that elephants that are overweight or have a high body fat, those are the ones that are most likely not to have a reproductive cycle, so they're not capable of becoming pregnant. So that's one factor. Looking at their current and medical history. So all of these different factors, we've had different studies that show they're related to their reproductive success. So then the goal is to take these individual females and look at these different factors to see if, in fact, hey, she's 26, she hasn't calved, but she is in really good health. And from what we know from our science, that it's worth that risk that she potentially calve. Because we don't have enough to say there's a hard line on this age. It should be more holistic, health related, and not just age alone. So putting these the science behind it. When I talk about, I sometimes just say these things like everybody knows. So I'm going to back up a little bit, just some of these things to tell you what we're looking at. So when I say we're looking at hormones and cycles, this is showing a profile for an elephant's reproductive cycle. And so what's happening is every time an elephant, basically for a human, we go through a cycle every month. For an elephant, it's about every 3 months. So this is tracking an elephant over how many years? A lot of years, 6 years. And so you want to see that increase, so that's progesterone. So you see that increase, which goes up right after ovulation and stays elevated and then goes down. So that's a really nice cycle. And so for the elephants here, we monitor the females here all the time and come up with these same profiles so we can get a really good understanding of the reproductive health of the females here. And the team has done this long ago. Like, they're the first ones that were involved in basic elephant reproductive health to figure out some of the cyclicity information. So it's just really cool to see that Kansas City was at the forefront of elephant reproductive research 18 years ago, and here we are again. So again, we do this for the females to see, number one, are they capable of becoming pregnant? Are they cycling or not? So an elephant that doesn't cycle, you'll get their profile and it will look like this. Okay, so if they're not cycling, they can't conceive. So that's one of the main things that we look at for all the females. I'm putting in some photos here of actually, I do big picture things, and this is details of the initiative. So this is the freezer room. I wish I had all those fancy freezers. I don't. I have the one on the right-hand side, and it's at capacity. And just to show you how many elephants we have monitored and monitoring as part of this initiative, and that freezer goes back, and each of those boxes hold 81 serum samples. Just to tell you the scope of this project is immense, and it has a lot of value, and not just defining reproductive health for each elephant, but these can be stored for years and years and years, so we can study other things in the future. It's really important that we contribute to science in that way. It's not just understanding things at this moment, but we have to think longer term. What could we potentially look at in these samples that we don't know that could help elephants in the future? So we're doing our part to set a good standard of doing good work and contributing to things in the future. So this is also Dr. Kirk. I need another freezer, and now you can see why. So part of this also, so we look at a bunch of different hormones. We looked at the reproductive hormones, health hormones. Part of this is also doing a reproductive ultrasound exam to look at the reproductive tract health as well, also very important for conceiving and for pregnancy. So we see Dr. Kirk and Scott there doing a reproductive assessment. So you think, oh, that was easy. We'll just go to all the zoos and do this. This took so much effort from the team to get to this part alone. And the cool part about this initiative is we present this, we have ideas, we go to zoos, we say we're doing this, let us look at your females. And they're like, oh, that's because you're already trained to do this. No, the team here knew that if we were going to promote this, we also have to do this here. So the team worked to get all of the females to this point to be able to stand to do this. Not sedated, nothing. Going into the chute on their own, fine, just eating the whole time. I mean, that was amazing accomplishment alone. And so it started with just going through the initiative. We made this document then to circulate to other zoos, because a lot of times we'd go and they're like, no way, we have to stop, we can't get our elephant trained for that. So I worked with Scott and his team and came up with this checklist of these are all the things that you should do to prepare your elephant for a reproductive exam. So that way it takes the fear of the whole picture, and step by step you work towards that. And so again, the team did that for all of the females, and we were able to do an assessment on all of the girls here, which is huge. So again, when we go to zoos, they're like, yeah, but did you do it? Yes, we did. We did it quite effectively. So it's really awesome. Just even these kind of materials that come from this are really helpful for the zoo community as a whole. And they don't exist. We're the only ones doing this. Like, it's really being transparent and collaborative for the good of the population. We don't sell this. It's just part of what we do. And they're all like, what do you mean you're not charging all of this? We do what we can. We have a limited budget, but we're making every use of every dime for that. And as we expand, yes, we're gonna have to fundraise and do more, and zoos will have to contribute. But the idea is we're gonna do this because it's important. And then we'll also figure out the funding as we do it. So it's not just based on the females alone, right? Of course, the males are very important in the reproductive process as well. There's only 39. So not as many exclusions. So if you look at there's only, 4 exclusions from the males from the breeding pool, potential breeding pool. So 35 males. And so we think, great, at least the male side is figured out. All we have to do is figure out, of course, make sure those young females get bred, put the research into the older females to increase that breeding population, have access to males, and then we've just solved all the problems, right? We wish it was that easy. So for AZA, males that are 8 years or older are recommended to be trained for semen collections. Now, to step back, you think, well, why don't you just put the 35 males with the females? Not every institution has a male, even if you have reproductive age or viable females. Only 22 facilities house these males, these 39 males. So not every zoo has a male. And it doesn't mean that if you have a male, he's necessarily going to breed. It doesn't necessarily mean socially that they're going to be compatible to breed. It doesn't mean that he is fertile and is capable of breeding. So again, just having a male alone doesn't guarantee breeding. And for the institutions that don't have a male, it's really, really difficult just to transfer males to different zoos for breeding, right? Zoos have to have specific facilities to house a bull. So there's all of these logistical things that you can't just move bulls for breeding and then it's solved. So that's when artificial insemination becomes an important tool. It's not the answer, but it's one tool in situations that has real conservation value. So many people get into the battle of, should we be a natural breeding institution? Should we be AI? It's not an either or. We need to build the tools because one day your institution is gonna go through these same issues. So you're not an either or. You're for elephants or you're for elephants. And so it's a responsibility for everybody to contribute to these tools so that when it comes time, you also have access to these tools. So it's not an either or. So looking at males, so how many males are 8 or older? 27. All right, awesome, we're still good. But how many of these 27 males are trained for semen collections? About 3. Ouch. So that makes it difficult. And what we've seen happen is the males that they were collecting routinely for the zoos doing AI, they're either no longer producing samples, the sperm cells aren't there, or they're not getting a sample, or the viability motility has went down significantly. So we're not getting, so back in 2008, when he had those successes, is because those males were producing really good samples, right? So the males that we're producing are also not producing as well. So it's really, we have a male issue here as well. Access to males, but then also semen, having semen collections, fresh semen for the AIs, and also cryopreserved. And I'll get into that in a second. So of course there's challenges. Education, right? It's not just something you know how to do or are expected to do. Not every zoo has an 8-year-old male or older. So how do you get the training to do semen collections? Again, the elephants that are collected are not producing reliable samples anymore. And then having that semen available for an AI. We'll get into a situation, I'll explain a story that we just went through a couple of weeks ago, where all of these things we ran into head on, and it just made this more evident that we really, really need to put efforts into providing education, get elephants collected, and improve the process for freezing the sperm cells. So just to kind of highlight this, so the elephant tag, Taxon Advisory Group, and the SSP is ran. The chair of that is based at the Indianapolis Zoo. So their team, I asked them to put together a survey to bulls to figure out the challenges within an institution, like why are so few being collected? What are your major obstacles? I already knew, but it's good for the institutions to start thinking about this, right? So the elephant tag did this on the initiative's behalf and presented this at the elephant tag meeting. And as you read through this list, not surprising, right? To train the staff and the elephants takes a lot of time and energy, and it's important, right? But how to do that as a team within your institution. It's just real logistical issues that need to be addressed. Like, you can't ignore that. Facility modification, safety, aggressive bull behavior, different political groups. So lots of real issues that need to be addressed if this is going to be a sustainable option. So the tag asked us, the initiative, Kari, here's the list for the suggestions. Can you guys do this? This is a pretty big list of, hey, you guys are doing a lot of good. These are the things we need help with. Will you guys lead this? And so to start down this path, even for training, right? So we'll get to our team has been amazing on collecting and training Tamani now, right? And that was a lot of just faith and, hey, we're gonna do this, commit to it, knowing that we don't have a lot of experience, but based on what we know, and Dr. Kirk and Scott have done this in the past, and so had I, so we were just going to do it because we knew it was important. But then to try to find an institution that's doing routine collections so that our team can go there to train or to watch or just get different experience, I've had no success in doing that, and it's so frustrating. Like our team wants to, and the staff here in management is willing to do that. But yeah, and so it's a huge collaborative thing across the nation. And so for us to do these things, good thing that we're really persistent and don't give up, so we will get there. But this is a large list, but it's very honorable that the tag goes to the initiative now for most things elephant reproduction related. So that just tells the credibility of what our initiative is doing. Sorry, Scott. But this is Scott. This is part of the process for the semen collection for Tamani. But again, just showing that, hey, we're going to do this. If we're going to talk about this, we're going to do this. And so again, huge applause to the team here to doing this, because Tamani's 12 now, and so we're committed to this, and that's huge. The staff's time, all components together, and then, but again, if we're going to do this, and so this is the goal. So yes, because we want to look at this, the semen quality just in general, and track that over time for his health, but this is a liquid nitrogen tank of cryopreserved semen samples. Now, I wish these were African elephant, but they're not. This is just from the internet, but this is the goal, where you have a storage tank, and basically what it does is it preserves these cells for years and years and years and years, 100 years down the road, right? So the idea is that we have a resource bank of frozen sperm, so that when there is an AI, then we are confident that we'll have a semen sample for that. And we're confident in the quality, and we can look at the genetics to make sure it's suitable. So this is the way to go for elephants. And that's because we were just involved in an AI at Indianapolis Zoo. They called, we really need semen samples. We have 2 zoos on board to collect for that window of time, that 3-day period that she'll ovulate. The amount of effort and time to arrange an AI for an elephant is insane. So to get zoos on board to collect on this 1, 2, or 3 days, because we don't know exactly when she's going to ovulate, we have this window of tests that we can look at, but we can do the test and look at it at that moment. So we arranged for 2 zoos to collect semen at the same time. So went to Indianapolis, did the test. Did she ovulate? Not yet, but we had to first tell the zoo if they were going to collect or not. So they attempted to collect, no sample. Well, that sucks, but she didn't ovulate, so okay, that's fine. So the next day, the next zoo that was lined up, they got an amazing sample, and we're like, this is really great. Did the test, well, her peak wasn't quite there. So we have a great sample, but she hasn't quite ovulated, and they can't just go collect them again. So all these logistical things. Well, then in the process of getting that semen sample to the airport, something happened and it all died, killed it all, right? Frustrating. So I'm gonna skip to something really quick, because so that middle picture is elephant semen that I had frozen 20 years ago from Dale, who used to be here. So the only frozen African elephant sperm was collected here from an elephant that is now deceased. And this is research I started 20 years ago. And then I started down the female route in endocrinology, did graduate school. And then when I got to this part, I'm like, cool, I bet it's all figured out. Nothing has progressed in this area. So thank God Kansas City had collected this years ago. And we have frozen Dale semen. So Indianapolis this is what we did. We had frozen semen. So we're going to bring this to Indianapolis. This is our only chance for an insemination for this elephant at this particular time. So bring it there. And then, again, this is all the frustrating part of it. And then she's not ovulating. We knew that this semen is so valuable. It's a deceased elephant. But Kansas City has the forefront to say, we're not just going to save it for our elephants one day. This is for the population. That's amazing, right? But the timing wasn't right. And we had funding for me to stay for 2 days. And so we had to leave, again, me packing this up and bringing the semen back with me without doing an AI because the timing wasn't perfect. We knew that this was really valuable, that we didn't want to do it unless it was perfect. So it came back with me. And I sat on that plane like so defeated. Like that felt like so much work, but we didn't even get to do an AI. But it just shows you the importance of having cryopreserved semen. So then zoos that are doing AI, it's there when they need it. It's not, can we, can't we, is it fresh, is it frozen? Like this is a normal part of industry and breeding industry for a lot of species, and there's no reason it can't be for elephants. So we're going to get there. I want to go back, just a couple of things. I'm not going to go into all the details, but the process of freezing isn't just collecting it and putting it in a freezer either. It's different formulations for extenders. So this is just showing the details of, again, there wasn't really a formula. So from the research we had done 20 years ago, went back to that recipe, added some new things based on some successes in Asian elephants in recent years, and came up with our own. So this is like the Kansas City semen media. I don't know the name. It has to be much better than that. But there it is. And it works fantastic on, this is a domestic bull testicle. So unfortunately, I haven't had any elephant sperm to try it on because no elephants are producing fresh semen. And so luckily, being based in Omaha, there's a slaughterhouse right next door. So I can go in and get all the testes I want and get bull semen that way. And bull sperm love it. It's perfect. So we're hoping it works similarly on elephants, but we don't have all the time or the collections to do all of these studies on figuring out the perfect formulation. We'll get there, but first we need semen to do that. I want to skip along. So we're going to go back to, so that you kind of understand the male part of the initiative of what we're trying to do, right? Perfect semen cryopreservation, have a semen bank, and making this accessible for zoos doing AI. One of the other things that we're doing through this is looking at pregnancy. One of the scares is because of miscarriage, right? We know so little about the hormones during a normal pregnancy. So through this initiative, we have gotten, again, the importance of keeping samples for years and years. We went back to successful pregnancies, 2 years pregnancy, weekly serum samples, and also serum samples collected during pregnancies that resulted in miscarriage. So for the first time, we're able to understand pregnancy at a basic level of what hormones are important. And this is important when, in 5 years, when we have all these pregnant elephants, that we can monitor, right, for normal pregnancy, so that if we see an issue, that we can be aware of it and make changes to hopefully increase the chance of successful birth. Just to show you one quick example, we're looking, so progesterone, which is the hormone that goes up and stays up during pregnancy, that's been looked at in elephants, but that's really the only one, but not in comparison to miscarriage. So it's just showing the one that was successful, progesterone goes really high and stays high, whereas the miscarriage elephant, this is only one miscarriage, so I don't want to make huge claims about this, but the miscarried elephant had a low progesterone from the very beginning. We know in other species and in humans that you have to have a certain level of progesterone to maintain pregnancy. So again, it opens up the idea of perhaps that's important for elephants, and if we're seeing that, is there a way we can supplement that to reduce the risk of miscarriage? So again, some basic research for the initiative, as well as doing the hands-on stuff immediately. Just a quick slide showing that the whole goal initially was focused on those 24 years of age or older. Also realizing through our work that the elephants that were imported in 2016, so this is showing some of the importations, they also needed our help to ensure that they were getting breeding opportunity. It's not just take it for granted that here comes elephants, problem solved. We also realized that we need to help ensure they're getting bred at a younger age, as well as helping elephants that are 24 or older. So again, these came in March of 2016. They came to 3 different zoos, and putting these elephants and looking at how they relate to the breeding potential, they represent 48% of a potential breeding population. So imports are important, and they have a huge role, especially as elephants are aging out. But it's our responsibility to ensure we're doing everything we can for them, for their long-term reproductive health, to breed them at a young age and not get to 24 and then you worry about it, because we just don't know what 24 means yet, and we're trying to figure that out. So just a quick slide of showing how the initiative helped get a Johnny, who is a 16-year-old male elephant, to the Sedgwick Zoo to breed those imports. So when the imports came to Sedgwick, a young male was also in that group, age 8, but he's not ready to breed. And so Sedgwick asked us, can you help us find a male that can come here for breeding? I mean, well done for them to realize that and put the money and the efforts to do that. So we helped sort them, different potential males, and there's not like all these potential males you can choose. It's very limited. So anyway, we helped through that process. And then we also collected samples on him, fecal samples we can get hormones from, and blood samples, to look at how his transition into this new social group affected his reproductive health and also the reproductive health of the animals that are there. So again, trying to understand elephant transfers as well, because I think moving males will be important, but we don't have enough information to support what that does. The cool thing is he was there for 30 days for his quarantine, had some introduction period, some phases. The female, who's 22, who they really wanted to breed, within days when they put them together, he was breeding her. It was like textbook. It was so cool. Just to find out, though, that she's not pregnant, so that's unfortunate. But the fact that they had that appropriate behavior is a huge plus. So again, the initiative helped with that. So the last thing is just showing, I just want to show a couple case studies that we are kind of the go-to place for how to help elephant reproduction at a personal level, working with other zoos, but always because we back it up with the science. And they know we're going to bring that to the table, and we're going to always expand on that. So the whole idea is that we put everything into action. It's not waiting for 5 years until we have all of the answers. It's doing what we know now while also building up our basic knowledge of elephant reproduction. So it's taking out all egos, all barriers between different zoos and people and whatever, and we do this for the sake of elephants. We work really closely with AZA, SSP, and TAG. We don't want to step on toes. We're here as a resource. And at first they're like, what? We don't understand. Why are you guys doing this? We're doing it because it's important. And Kansas City is going to change the fate of elephants in the zoos. I'm very confident, and it's already happening. So that's the idea. It's large, and it's just expanding. And we go to different directions based on need. But at the end of it, we do good science. And we like to end with this. This is just some pictures of my girls growing up with elephants, going wherever I go with elephants, whether it be zoos or Africa. And I always say that shame on me if I don't do my part. I would hate in 50 years, they know I'm an elephant crazy lady, if they would say, Mom, why didn't you do more? Mom, you knew that. You told us stories about that. Why didn't you tell the other people? So at the end of the day, when it's frustrating all this, I always say, I want to be able to tell my girls I did everything I did, and I want to be able to have their children go to the zoos in Africa and always see elephants wherever they may be. And so for that, how am I on time? You approached me, so I was like, I better hurry up. I did. So thank you for listening. Thank you again for the team here and everybody in here. Spread the word about what we're doing. It's important at every level. So if you have questions.
Anybody have questions?
I think in the back, if we can.
From a single semen collection, how many breedings can you get from that?
Okay, so the question, if you didn't hear, was she asked from a single semen collection, how many breedings can you get from that? There's a lot of variation in that depending on the volume we can get from a collection. So to do an insemination, we use 50 mils. I talk mils. We use 50 mils for the insemination. A sperm collection can be anywhere from 40 mils to 200 mils. So we don't know. So up to 4. But it depends on the quality and other factors as well. But it's not like we can do 50 inseminations. Maybe when we perfect the technique and make sure every sperm in there is 100% motile. But at this point, 1 to 4. But again, kind of depends on the quality. Yeah.
But what is the gestation, the proper term for pregnancy and sperm?
Yeah.
Looking at the chart, is it 3 years?
It's 22 months.
22 months.
Yeah. So you asked what the gestation was. Sorry, I didn't do my job if I didn't tell you that. Gestation is 22 months for an African elephant. Yeah. Yeah.
Yeah, on your age limit on your female elephants being holistic, you said, did you put a upper limit? Did you not look at elephants above the age of 50, 40, or anything like that?
Yeah, we didn't at this point because we just wanted institutions to participate. And actually, all of that information is important. So we would welcome any age elephant to participate because we just don't know what that would look like for an older elephant. And I have to say, too, that we are really hopeful that we would get all this ultrasound data and then move on to the next step. But we are super limited in resources on that's really a really skilled technique. So we bring in experts right now. We can do it some, but it's at the discretion of their availability. And so it's not as, I was hoping we could just do all these ultrasounds, but it's not adding up to be. So we're focusing on other things as well, building that up. But that's a good question. But we're not limiting it to a certain age group because we want to understand reproduction at any age. Even those that are younger than 24, we'd be willing. We want to look at just reproductive health overall. The question was, how do you tell the age? So in zoo elephants, the age is recorded based in zoo documents based on where the elephant was previously. They usually have birth records of where it was birthed. If it came from the wild, it's an age estimate they did when they imported it. So that's based on different characteristics, just different age scales. Basically, you can look at a document of body size, and then that's an age estimate. But otherwise, the records are really detailed for birth date for the elephants.
When did the warning sign come about in terms of what year did we know this is a problem?
Yeah, that's a great question. So his question was, when did we know this was a problem? And so we knew this was a problem about 10 years ago when through the Smithsonian, they've been tracking reproductive cycles in African elephants in North America for about 20 years. And so at first was, let's just see who's cycling or not, right? So they got this picture. And then I think they did that 15 years ago. And then they did it again 7 years later and saw that 46% of the population had went to non-cycling when they were of reproductive age. So they do these surveys every 5 to 7 years, and we see an increase in the number of non-cycling elephants, so those not able to conceive, and that number of infertile elephants for one way is going up, up, up. So we're not seeing a reverse in that. So yeah, so about 10 years is when we were really like, this is an issue. But that's a great question because without basic science, we would never really know except for a lack of having calves. Yes.
Have you seen any correlation with when a male is brought in, do the females start cycling, or like with our group of girls before Tamani came, did you see any kind of increase? I mean, they're all older, I know, but.
Yeah, that's a great question. So her question was, do you see an increase in an elephant starting to cycle when you bring in a male? And this is versus just building this database, but what I'm seeing is, yes, you do see it. And it was almost beautiful at Sedgwick with one of their younger females, which at age 7. So again, we're tracking these females young because we want to catch puberty. That's not really documented well either. We think between 7 and 12, but putting science behind that. So I brought the male in, that Johnny. He tried to breed her, and then immediately she started to cycle. Like crazy, right? N of 1, but still, and I've seen this in other situations. So we did do a study looking at, does the presence, having a male there increase your chance of cycling? And it does. That's one of the main factors, just having a male present at your facility. But our females are older, but most of them are cycling. It's amazing. Even Lady, who's 50 exactly, she's cycling. That's amazing. Yeah, I mean, it shouldn't be that amazing. They should cycle that long, but it's rare for zoo elephants to cycle that age, yeah.
Everything's subject to change, but realistically, of your exclusion group, how many females do you feel like you would be able to put back into the potential breeding possibility?
Yeah, that's how many females from the exclusion group can we bring back? And a time scale within like the next 5 years, I'd say 10 would be a good, and again, this is not saying this is what we're doing, but I feel if we put the efforts into it, and the zoos that are willing to do that would be an appropriate goal, and that would boost the population significantly. I'd like to say more, but I feel like that's a fairly realistic. And we've already have zoos willing to do that, which is amazing. We've done some assessments, and they've been in their mid-30s. They've calved, but it's been 10 years, and they're willing to do the AI and stuff. So zoos are on board and understanding, hey, I think I excluded too quickly. Not saying that it's going to happen for sure successfully, but we're willing to do that based on what we know. So we're already seeing zoos willing to have that conversation and use the science to do that.
What factors went into the wild elephants that were brought here to help with the population, and why did you choose those specific elephants?
The question is, why were those specific elephants chosen to come here from Africa? Unfortunately, I didn't choose them. I would have chosen in a different way. So I don't have the details of why they were choosing, but they were choosing younger elephants for that reason with breeding in mind, right? So the idea was bringing in groups of younger elephants, but also some older, not old, none of them are over age 24, and also bringing mostly females, but also some males because we knew males were important for the breeding population. They also chose family groups, or at least from some of the same areas, but I don't have the details of that. So they didn't just go pick out 17 random elephants, but they were from a certain area. I wish I knew more about the way. I actually begged that they collect fecal samples over there and keep them, because I wanted to look at the hormone levels there, right, kind of before and after, just so we understand what happens. But of course, unless you're right there collecting the poop sample, it's probably not going to happen. So they say they're there. They're collected somewhere in Africa. So I'm going to go find them, but I haven't yet. Yes?
Is it pretty much the same picture over in Europe or other international zoos? And what is the realistic potential for AI international?
The question was, how does this look in comparison to Europe, and how does AI potentially play a role in that internationally? So there's not as many elephants in European zoos. The population is way more reduced comparatively. We wanted to do these studies looking at the factors there as well and see if reproduction is better. And in terms of cyclicity, it is improved, it is better if you just compare cyclicity versus not in European zoos. Now the why of that, is it because they have, I don't know the reason, but it is better. In terms of AI, that is the idea, is that it can be a global thing. The problem is there's huge restrictions on importing and exporting semen right now with potential disease transmission. So you have to overcome that obstacle, which is what we're also part of this, which is important, because just because it hasn't been done doesn't mean it shouldn't. They do it for other species. It's just a process of regulatory stuff and ensuring it's disease-free. But it's going to be an important tool. AI had, in the last, I had that slide up there, 23 births from AI for African elephants in the last 10 years or so, maybe 15 years, sorry. But there's not a lot of opportunity to try. So it's not that it doesn't work, you just don't have a lot of opportunity for repetition. And it's just the logistical details and the cost for getting the people that actually do the AI. So again, that's not sustainable. So that's part of this too, is how do you make that process sustainable? It can't just rely on 1 or 2 people that can do this in the world, right? So the idea too is education. But you look at other industries, cattle, horses, right? Not that we're gonna get there, but we can get further. We just need more focused efforts. And so yeah, the answer is we need to get there. We're not there, but I think it's definitely doable. We just have to put in the efforts.
What do you find as the biggest roadblocks in the United States?
Yeah, biggest roadblock in the United States has been probably a overall collaborative approach to this. Like if you know you have females, and you know you have a male, you can't do semen collections, he's not breeding your females there, to make those decisions that perhaps it's best for him to go to a breeding place. So relationships and education. And also it's not necessarily one zoo's or their fault, it's just not understanding, right? Maybe not understanding the severity of the issue and not understanding how this can work as a unit. So taking some of those blocks out. And just basic elephant biology and reproductive health. So that's why we gather all of this stuff, and I know it seems like maybe too much, but it's important that we understand how elephants settle into a zoo environment from Africa. So we've done that through this. So from the day those elephants got here, we've been monitoring them to see what happens in terms of the reproductive health, other health factors. So yeah, so some basic science too, which I think will help ease fears and make some informed decisions. But yeah, collaboration and education.
Okay. Thank you so much, Kari.
You're
that
welcome.
was very informative. I know we've had a lot of questions, so I was glad you could join us. Kari is here on and off throughout the year, so you'll see her again, I'm sure, sometime. Thank you for attending the conservation lecture series this year. Although it's next month, we will be starting session 1 of 2019 in January, and we're going to kick it off with Sean and Kelsey talking about Wyoming toads. So there's a lot going on with that too. So it should be exciting and have some fresh content. Enjoy the Chiefs game tonight and your holidays, and thank you so much for coming.
Thank you.
And you guys, thanks for coming.